Behind every patient with COVID-19 fighting for their life, there is a team of doctors and nurses, nutritionists, lab technicians and cleaners, men and women who risk their lives to keep overloaded hospitals running during the pandemic. Now a statue named Angel of Kindness has been unveiled in Tehran, honoring those caregivers, veterans, and those who have lost their lives in the conflict with the coronavirus. Military leaders say they're ready for any future outbreak.
We are 100% prepared, despite you saying it took everybody by surprise. I think we fought with the virus quickly, and we are definitely ready for the second wave, and our preparedness is far greater than the first wave because we've gained the experience.
Shohadaya Tajrish Hospital has been at the forefront of Iran's pandemic response.
At the height of the outbreak in Tehran, this hospital would have been one of the main treatment centers for sick patients. Inside, people are still being treated for COVID-19. Outside, a ceremony to honor the healthcare workers who continue to be on the front line of fighting this disease.
As the worst of the disease in Iran seems to be over, this was a chance to take a break and take stock. Not everyone who was in the fight is still alive to celebrate what the government calls a victory.
This is a very dangerous disease, and we shouldn't downplay or look at it as an ordinary sickness. We shouldn't think it's over. I personally fell ill. My husband fell ill. We saw patients in hospitals. Nobody really imagines they will contract it. The medical teams are really worried about the second wave of this disease. We have to remain vigilant.
This woman's husband did not survive the virus. Such ceremonies are perhaps little comfort to doctors and nurses who were foot soldiers in this fight. Some told us the government mishandled the response. Many said they contracted COVID-19 in the line of duty. Many lost family and friends. Ghulam Reza Fakhri died in the outbreak a little more than a month ago. His wife warns the disease is still a formidable enemy.
He was an ICU man. Most of his time was spent in the intensive care unit. He contracted the disease while he was inserting a tube into the mouth of a corona patient. After placing the tube for a young girl, he told his colleagues, "I think I was infected." You know, he was very close contact with patients, a distance of 5 to 10 centimeters.
Despite the risk, he never said no when called, and for years offered medical services to charities free of charge, something his wife discovered only after his death. The last thing they talked about was what might happen if he got sick. "You might die," she said. "It's okay," he replied, "I will die a hero." But heroes have families, people who get left behind. Wives who grieve for their husbands, daughters who want their fathers back. Survivors of the pandemic, but also victims who are uncounted when tallies are taken of the sick and the dead. Zein Basravi, Al Jazeera, Tehran.